Okay, so we're now going to talk about knee pain a little bit. I have a knee, and yeah, one thing we can just quickly point to here. Sorry, how rude of me. This is Hannah. Hannah actually works with me, but we're just gonna highlight something for Hannah. But let me do a little bit of talky stuff first. So the kneecap, right? So that shouldn't be like that, clearly. That's going to insert in there, but just to show you. So here we have the patella, and we know that the patella, the kneecap, sits within the quadriceps tendon, and it moves up and down the femur like so. And it moves up and down inside a groove here in the femur, a big groove, and it tracks, that's the word, it tracks up and down when we flex and extend our knee. Now, that groove is actually called the femoral groove, if you're interested, but it's a groove in the femur. Patella tracks up and down. Okay, so sort of think about that a little bit. One of the things that, so if we're talking about knee pain, maybe when squatting, but certainly one of the reasons that we can get some discomfort here is that we get maybe some increased medial stress on the knee. So what I mean by that is that the knee goes in towards the midline a little bit. So it collapses in towards the midline, which changes the orientation of everything in the knee. That's actually called it's like a valgus, it's called a valgus stress, pushing that knee inwards. If we sort of look at this camera a little bit, so what that would mean, you know, for Hannah is that sort of thing would happen. So you'd feel that sort of stress on the medial aspect of the knee. And you actually do, I think, Hannah, get some pain in your right knee on the inside of the knee. Yeah. Yeah. You run, right?
Yep, I run.
And high rocks as well. So high intensity. Great stuff. Okay, so we get that sort of neat medial stress. One thing to remark on here is that there is an angle from our hips down towards our knees called the Q angle. I won't talk about it in detail, but you can probably see that women generally have wider hips, right? That's how we're anatomically set up. So wider hips means that wider here, coming into the knee, you get an excessive Q angle. Does that make sense? So that creates, again, more of that valgus stress, or the more potential for that to happen. Yeah. Yeah, it doesn't have to happen, but more potential. So the Q angle's a little bit of a factor as well. So we need to be aware of this potential medial stress, because if when we squat, Hannah, and if we squat together, our knees sort of collapse a little bit like this, then that's going to create that stress, right? That medial, that valgus stress. Okay, fine. So we're going to do a little test called the Trendelenburg test. So we're going to get you to just stand on your left leg and just sort of, we're facing at the camera. Okay, good. And put the foot down again for me. That was good. One thing, and up again. One thing I think we can just see there a little bit is that hip is sort of wandering out a little bit, and that this side is dropping a little bit. Yeah? Try it on the other side for me. Okay. Okay, maybe not so obvious there. Okay, but there's a tendency, maybe it's a bit shaky there, and there's a tendency for this to wander. If you come back to a normal standing position, the other thing I can see on Hannah when I look at her knees generally, I don't know if you can see that on camera, but they tend to sort of be like this a little bit. They're sort of like preloaded. They're already facing this way because we've got some internal rotation maybe going on. That's maybe coming from the hips a little bit, okay? So what we actually saw there, maybe, and up again on the left leg again for me, there is a tendency for that, exaggerate it now, there we go, sorry. So there is a tendency for that to happen. This drops, this goes out to the side. That's the positive Trendelenburg test, okay? Trendelenburg was just the guy who invented the test. Now, why is that? So we're here, and the hips sticks out to the side. What we would associate that with is a weakness in our gluteal muscles, specifically a weakness in your gluteus medius. Mm-hmm. Okay? So gluteus medius, which is an abductor, also involved in extension, but an abductor of the hip, needs to be strong because it's holding us in that position. And if it's not strong, it will drop out. Yeah, and what tends to happen when that drops out is that creates that more of a tendency, because it's now a sharper angle still to the knee, more of a tendency to stress the knee. Yeah? So that would suggest to us that what we need to do in that situation when we're working with Hannah is that we're going to need to address that glute med weakness with glute med focus exercises, which might involve some element of abduction, because that's what they do. Also, generally to strengthen up the glutes a little bit, because one thing we can see, like I say, is that we're tending to see that Hannah's knees are sort of, it looks, there's an internal rotation. They're focused this way. We need to try and get some external rotation into that. Glute max is an external rotator of the hip. Yeah. So it'll draw us out a little bit. So training the glutes makes sense to address this. It's not massively marked on you, I've got to say, Hannah, but there is something there. And you do get some medial knee pain on the right. Yeah. And you do run. One thing I asked Hannah earlier is, do you ever get any sort of lateral knee pain? Because one of the things that happens with this internal rotation is that it actually stresses the iliotibial band that runs down the side of the thigh. And that can create something called runner's knee, which masseurs, and when we get on the couch, are constantly working on iliotibial bands because they're tight, and runners get pain because of that tightness. Yeah. More common, in fact, when people are anteriorly rotated at the hips, which tends to create at the pelvis, anterior rotation, lower cross syndrome, femurs roll in, they internally rotate. And if we look at Hannah from the side, we can probably see elements of that lower cross syndrome.